Somewhere, I think you always like.
Oh, okay, yes.
Where's he when I get to? I don't know, I feel like you're best person. We left her the first.
We're gonna go ahead and get started. Good morning, everybody. Thanks for coming to this lecture. We still might have a few folks trickling over, but it's my pleasure this morning to introduce to you our next speaker. And I'm gonna kind of let him introduce himself and tell a little bit about his background, but this is Dr. Mayer.
Sorry.
And he is one of our phenomenal sports medicine doctors with Common Spirit, but he's also the head doctor for the Denver Broncos. And he's got a really awesome lecture plan for you guys. So if you guys will join me in welcoming him, and he's going to go ahead and give you his background, and we'll go from there.
Thank you, Gina. Look, thank y'all for having me. Scott Phillips called me, I don't know how many months ago, and was like, "Hey, will you come give a talk?" I said, "Okay, who am I giving a talk to?" He said, "A trauma presentation." I said, "Well, you got the orthopedic trauma surgeons and vascular, you'll hear all that." I was like, "You're asking a sports medicine doc." I was like, maybe I'll just give something different, just a sports medicine background of like what it's like, I guess, in my world. And hopefully it's just a behind the scenes. I'm just going to kind of give you what I do pre-game, during game, post-game, and how EMS works with us a little bit. And just, I don't know that it's really a lecture. It's kind of a story of kind of stuff that we do behind the scenes in the NFL. And I chose the NFL. I've covered high school, college, and NFL. And NBA. I chose NFL just because the standard of care there is unbelievable. If you want to die on a football field because you got everything there, literally. And so I was like, well, I'll just put something kind of maybe more of an entertainment. I don't know that it's lecture wise or anything like that. I think you'll get more just kind of, okay, that's the behind the scenes and that's what they do. Then you're gonna learn something, groundbreaking. I'm going to teach you, and hopefully the orthopedic trauma surgeons, vascular surgeons, neurosurgeons teach you stuff in the field, and even the general surgeons teach you stuff. So my background is, yes, so I'm the head team physician for the Denver Broncos. I used to be the head team physician for the New Orleans Saints for years. And that's what started when Sean Payton came over here. They kept calling and trying to get me come back, and were recruiting me here. And I told them, I was like, look, I don't follow pro teams. I'm a sports medicine doc. I take care of the little athletes all the way to the young at heart athletes that just want to be active. And that's really my career, my path, and my passion. It wasn't that I grew up wanting to take care of an NFL team or anything. I kind of fell into that. I was a former college football player that got hurt a lot and was that guy that met a doctor and didn't know what doctors did, and didn't have any doctors in my family or anybody in the healthcare profession, and took me down that route. And 20 something years later, this is, I guess, what I do for a living now. So people always ask me that sometimes, but no, you don't like just grow up and I want to be a team doc. I had a practice and was recruited out of Dallas to New Orleans. That's where I was practicing to then do the Saints. And then when this came over, and the partnership with Common Spirit was phenomenal, because what ended up happening is the Broncos kept calling me, but I wouldn't come because it was like, I'm not following a professional football team. You don't know where coaches go and ownership and this, that, and the other. But Common Spirit wanted to build an orthopedic sports program. And I didn't know I understand the landscape of Denver, but you had, what was it, Centura, and then you had this what they want to call this disaffiliation and all this, and they lost orthopedics in South Denver, and they were looking for someone to build and run an orthopedic sports complex. Well, the Broncos and Common Spirit happened to be looking for two things, and it became me. And so I said, okay. So that's what brought me to Denver, and to build a place and to build a sports program for Denver, and Common Spirit specifically. So they made me the sports medicine director for Common Spirit, the mountain region. So I guess it's Utah, Kansas, and Colorado. So then what I'm going to try and do is build a sports program, a true sports program, just like we have in other parts of the country, but bring it here to Denver. And that's what I'm doing. So I recruited a couple partners already. I have 3 others under NDAs, and I have 5 more coming next year and the year after. So this presentation is really just going to be kind of the NFL version of this. And the NFL version of it meaning like, hey, what's the highest standard? What's the achievable standard that we as professionals, medical professionals, could do if we cover sports games? So I just want to take you through a behind the scenes look at this and stop me throughout this, ask questions. Cause I want this to be as beneficial to you guys. I really didn't know really what to talk or lecture about. So just chime in because there's gonna be some stories, some random stuff in here and just, stop me at any time. So when you start this entire thing and you're like, okay, where does game day coverage begin? Well, it starts pregame. Like you can't just show up to a game and cover a game and be like, well, I'm here. It takes a lot of background. And so I think the first most important thing when you think about pregame, it's really this whole cycle here. And I'll kind of walk you through it. So the first thing before you do anything is you better go get a team. And so when I look at all these guys, this was my team in New Orleans. Let me see if my pointer, yeah, you guys can see it. Okay, so here are you guys. Here's Chuck and here's Bryven. So this would be you guys, right? I mean, if you guys are ever involved in NFL or NBA or MLB, it's kind of part of the whole team. And so this is where we practice our every year, twice a year, pretty much our emergency action plan. So we would run through our entire thing. Where does everybody fit in? Everybody's just as important as the next person, and everyone's got to do their job. Because then it doesn't matter if I don't do my job, everyone's got to do their job. In other words, like everyone just do their job. And then so every person here that you see across this entire picture kind of has a job and they just need to do their job for any emergencies and everyone has their role and we just practice it. And just like the team practices their plays and their coverages, we do the same. And so, yeah, every team has to have a quarterback, but I don't care how good of a quarterback you are. If your offensive line sucks, you're not doing anything. So everyone's got a role. And so this is where it starts, and this is where really we set everything up. So Chuck was kind of our head guy that kind of ran a lot of the stuff as we would kind of the chain of events would occur. And I'll show you how this sequence plays out with all these people as we go through the story. So I'm telling you, we practice. So here's just some photos of practicing. So we go through scenarios. On the left was us in New Orleans, and here's some pictures I have from here, here now, then in Denver, just practicing, going through scenarios, going through real life situations that occurred, going through game day, like in sporting events. Is it a cervical trauma? Is it a cardiac arrest? Is it, hey, took a direct blow, multiple rib fractures, now he's got a splenic lac, and now he's bleeding. Well, we took those same scenarios from the NFL and even tried to come up with some of our own to go through the whole chain of events. Because until you practice it, you don't really know what you messed up. You don't really know what didn't go smooth. Then you sit back and we kind of go through the process and we have an independent third party run it for us. And so they come in to kind of help scenarios, but kind of discuss, hey, we like the way this went. This took too long. Hey, you should have had this done within 2 minutes. Hey, CPR should have been started within 30 seconds, etc. We go through certain scenarios, but we kind of check ourselves. And so I've done this for many years. These were just some of the photos that we had. But even it goes down to even as simple as, look, Sean is running kind of at the head of the bed. So here's Bryven, managing. We're about to transport, just little scenarios like where does everybody fit as detailed as when you log roll or spine board. Where should you be? Who's the first person on CPR? Will it be me? Who do I pass to? Which one of you is tapping my shoulder saying, hey, doc, I'm here. You're next in. Cool. I'm out. Pass the baton. Next person's up. And so it's real seamless, but we practice it over and over again. Before the game, this is just some pictures of the 60-minute meeting. So I have to run a medical meeting at Empower Field, and whether it was a Superdome when I was there, 60 minutes before the NFL every game, and I have to run through. And so this is just some photos of everyone that's involved here. So, here are you guys, right? So here's where you would be with me in the team meeting, going through. And we go through the whole thing of, all right, where, we got anything that happens, where are they going? And primarily it's to the other team to make the other team comfortable with where's X-ray, where are the cold tubs, where's the hospital transport, where do we transport, where's X-ray, where's EMS station, what if EMS leaves with someone, who's the backup, who comes in, where are you guys stationed, do we use your spine board, do we use my spine board? I mean, I go through all these checklists every game, 60 minutes before every single NFL game. And so you're just kind of seeing all the folks here. And so the refs come in, they give their little spiel, they all say the same things. There's this one guy that's really crazy. He always comes in every time and we get radios and he tells the same story over and over again. He says, okay, guys, I need you to radio in. If you see something, how are you going to radio in? I need you loud because there's other voices in my head. That's what my wife tells me. He says the same joke every time. I mean, literally, this is like on year 5 with me listening to this guy's same joke. Says it every time. So anyways, they'll come in, they do their little spiel, and then I'll run the meeting, and then, we move on, we exchange communication information, and we move on. Speaking of communication, so we all have radios. We're all teed up. Everyone's teed up. Everyone's on the same radio, so we can talk, right? I mean, most errors, what are they driven from? They're driven from communication errors. So we're always on them. I got my earpiece in. I kind of tie it into my jacket and tag it here, but you're always hearing, but it's loud in the stadium, but you got to be able to hear. And so we have our own kind of line of communication within the medical staff throughout what's going on in the game. So then location, I'll kind of briefly go through this slide because people are always wondering, you watch an NFL game, you're like, who the hell is everybody? Like, what is going on? So, so we'd start at the top, certified athletic trainers, these spotters. So they're basically in the booth where they're at. Some of them are on the sideline, but they're monitoring the video replay. Because look, I may be standing there and then I got like the offensive line about to go and I'm kind of looking. Sometimes I don't get a great line of sight. So they're kind of the eyes up top. So they can call in and be like, hey, you got to check on 89. 89 got up kind of funny and just kind of was like not acting right. They may buzz down. 89's got to get a concussion check. So you may be watching an NFL game, you see a guy, you're like, okay, that looked a little funny. And then like 2 or 3 plays later, guy's off the field or the blue 10 is up. They'll help us if we don't see something. But they also, sometimes it wears me out because they'll wait and it drives me insane when like you kind of know something's going on, but they don't buzz down and then they buzz down like 6 plays later. Coaches go nuts on that. They lose their minds. And so, but it's a hard job. And I always tell them in that 60-minute meeting, look, if you see something, just say it quick and just be done with it versus delaying. These UNCs are these unaffiliated neurotrauma consultants. They could be ER docs, they could be neurologists, they could be neurosurgeons, and you'll see them in the sideline. And if you watch them walk into the tent if you ever see them walk into a tent with a red hat on, it's usually not me, the orthopedic surgeon. It's usually our primary care or concussion physician. They have to walk in and do the concussion exam at the same time. So they're going in and they're doing the concussion initial tent eval, and they're supposed to be the independent one that just makes sure that I guess the team is doing it correctly, as if we're, not going to do it correct and just, send, Bo Nix back out and be like, oh, you don't have a concussion, go back out there and play. And so they're there just for kind of just to watch, just to make sure the process is done correctly. These AMPs, these airway management, so they're also in a red hat. They're at about, and it's really, I wouldn't say 30, 40. They're probably like the 20, 30 yard line. They're there for emergency airway. So they're called the AMP. The NFL changed that name to call them the ERP, emergency response physician. They want 2 of them, but one will act as the airway doctor. So they're there and they're obviously there for just the emergency intubations. Then me, I guess I fall into I'm in this little bench area, team staff, so I can kind of walk wherever. So you just see me, well, I'll walk the sideline typically and just kind of stay just outside the bench, or I could be in the bench, but I just kind of move, stay out of the way. The way I always tell any of the docs that work with me or have ever been on an NFL field, that's Sean Payton's operating room for those 3 hours, just like my operating room. I don't want people screwing around, doing stuff. Just let me do my work. And I'm just a consultant. I'm just a rep. I don't know if you guys know orthopedic reps or whatever, but I'm just a rep. I'm just there if needed. I'm like the chief safety officer, Sean Payton's operating room for those 3 hours. Let me get the hell out of the way. Let him do his thing. I get it. I played football at Texas. Mac Brown, he wasn't that crazy, but we had some coaches that were crazy. So I get it. They're nuts on game day. How many of you guys saw the Giants guy get cussed out? So Scott Rodeo is a good friend of mine. Yeah. And so Dayball just goes and sticks his head in the injury tent while they're doing the concussion thing because he's losing his mind because it's taking too long because some spotter called down to go get Jackson Dart checked out. So he loses his mind. Well, he's probably going to get fined. And then you see this awkward interaction. I was telling my buddy, I was like, Scott Rodeo should have started yelling at Dayball because he would go down in history. Could you imagine like one of me or my other docs just cussing out Sean Payton just right there in the middle of the game for a medical thing? It'd be legendary, but I don't know if I'd have a job. I don't know how that would go. No, but Sean's a good guy. I've known Sean for a long time. And then the injury, this IVRS, this last one's really neat because it gives you the full video replay. So I can literally have my partner, or if I have time, I can walk over and see exactly from 3 different angles what happened. I mean, it's like cheating. It's like an open book test. You like walk over, you're like, all right, yeah, that's a high ankle sprain. Or you walk over, it's like, yeah, he tore his ACL, or yeah, that's definitely a valgus blow to the knee. I mean, it's unbelievable how much like information you get. I worry more about covering a high school football game than I worry about an NFL game because the amount of resources, help, support, it's unbelievable on an NFL sideline. In high school, I'm like sweating bullets because I'm like, who's helping with the C-spine injury? Is EMS here? Are they even covering this game? Where's the athletic trainer? Does the team on the other side have an athletic trainer? You have no idea. It's way more concerning. So that's the location. So now when you watch a game and you can see, you kind of know what's going on the sideline. So now it's game time. Okay, so you got everything ready. We finished the 60-minute meeting. We got everything done. Now, the game's about to kick off. So what are we doing now? Well, essentially, I'm doing workers' comp, except 17.5 million people. That's the average audience that watches an NFL game is watching what we do and critiquing us or playing Monday morning quarterback or getting on X and saying some stupid comment or whatever it may be. So someone sent me this. So you could be on the cover right below the president. You could be spine boarding Chris Olave off, who has an unbelievable, probably one of the worst concussions I'd seen, spine boarding him. They're going to look at everything. Hey, is the face mask off? What are you doing? Who's my EMS? What are we doing? You can get critiqued on everything, and it could be right there. So you gotta be ready for a lot of that stuff because you'll have, again, 17.5 million people watching every NFL game on how you do everything. All right, so you get through pregame. All right, now it's like, okay, fine. You got through pregame, you're ready to go. What do you do in game? All right, what's going to happen now? So when you get to end game, every play, you're just on high alert. And so my whole medical team is here just watching. And so you have to watch. I'm standing here. You got to watch every play, like, because it's a car wreck. These guys with GPS monitors on them, they run 20, 21, 22 miles an hour, full speed. And they're hitting each other every play. And it's loud, it's violent. The amount of injuries and the violence of injuries that I see, they're car wrecks. I mean, I worked at Charity Hospital in New Orleans. I mean, I saw gun violence trauma. I worked at UT Southwestern in Dallas, Texas. I saw it. I mean, it's car trauma every single time on some of these joint injuries, fractures, open fractures, and I'll go through a couple of these things. But I mean, you just got to watch it because if you can see it and you can then react a little bit quicker. You're not caught off guard walking out there like, what happened? So, all right, so let's say on field. All right, I get there. Guy goes down. What am I doing on field? Or what would you be doing if you were the first person on the scene, right? So we're evaluating. We're trying to figure out what's going on. Now, obviously, you may get to a patient, they may be unconscious. I may deal with the same stuff. You guys may have a crazy scene. I just have to deal with one player. But you got to get out there and just kind of slow everything down and just kind of go through your basic training and don't skip steps. Just do the same thing every single time for every single patient so you won't miss anything. So you're out there, you're initially evaluating. And I put this picture in here because it's funny, because Foster's a good dude, but Foster cussed me out like crazy right here in this picture. You'll never know that, but he was concussed. And so he was not himself. And he was ripping me, mother effing me, F bomb, don't effing touch me. I'm walking off the field. He had concussion, right? So we're helping him come off the field. And so we kind of know that. You already know the player. So you immediately know that's not Foster. Foster's not like that. So, all right. So you get the player, you get him off the field. And people are always like, well, what do you do in the blue tent? All right. So let's say I'm walking him off the field. So I'm walking him off. What are we doing as we walk into this blue tent? And people always ask me, well, why do you always wear jackets? And I always say this, well, I'm just going to their place of work. If they came to my place of work, I dress like this every day in clinic. I just happen to go to your place of work. I don't wear Broncos gear. I don't wear Saints gear. I don't wear any of that gear. Now, the guys on the team keep telling me that you're eventually going to change because it gets cold as hell here in Denver and you're going to put some warm clothes on. But my philosophy with that all the time was anytime I took care of an athlete, I don't care if it was a high school kid, a pro athlete, whatever, if I'm wearing your full team colors, are you going to look at me and be like, that person has my best interest? Do they care about me as a dad and a future grandfather and someone's son, or are they part of the team and just want me on the field? So I just don't wear it. I mean, I never wear the gear for that reason. That's no other, and because I dress like this every day in the clinic, so there's really no difference. So we get him in there. So now we're in the tent. All right. So now what do we got to do? So you better make a diagnosis real fast with not a lot of information already. You're trying to figure it out right there because immediately you're Special teams wants to know, is he out there? Offense wants to know. Defense wants to know. You got to relay it. Then I got to tell my head athletic trainer on the radio to go tell our ATCs and staff to go find every coach to tell him whether or not that guy's up or down. Because if he's down, who's the next guy in? Because the game's still going. So now we're on third down. We're about to punt, but one of my guys went out who's on punt team. And now we got a 5-yard penalty. They're going to be losing their mind on me if I don't tell them on who's out there, because now you're getting a penalty because you roll out 10 and they burn a timeout. Now they're even losing their mind. So you better make the diagnosis fast. Are they in? Are they out? So you got to do that real quick. What do I have? Well, I used to have X-ray in the tent. I made the New Orleans Saints buy me a portable C-arm that I actually had in the tent. It was like this big. And then I was at an NFL game in London 3 or 4 years ago, and they took it from me out of the tent. The NFL guy walked in. It was Jarvis Landry. I was evaluating his ankle, and they took the thing. Like, you can't have this. I'm like, what? And the guy was like, yeah, you don't have registered X-ray privileges here. I'm like, yeah, I'm in London. Of course I didn't do that. And then they made this whole thing about, well, what if there was somebody standing, around the tent? You don't have like the X-ray signs. I'm like, it's a mini C-arm. The field of X-ray is not even like 1 to 2 feet. Lost their mind, took my X-ray. So now I have to hide it in the locker room. Injections, I carry injections in the locker room, and I leave them in the tent too, because there's a lot of stuff I can inject and go back. So if I know it's a grade 1, grade 2 AC joint, guy got smoked, he's out, it's stable, I do a full exam, I can inject him, he's back out. Because the difference in a starter in the NFL and a backup is light years. Like it is no joke. And the NFL is so almost matchup dependent. You got a second or third stringer, it's not college. You don't have 5-star after 5-star at Alabama or Texas or whatever. You have a guy, the talent level is not the same. And then that next play or that series that they're out may decide the game. So you got to figure out real quickly, is this guy safe to go out? Can I do something? Can I not? What can I do that's reasonable and get him back out there? But you have to have everything planned quick. So I carry a lot of these things with me. Does he need retape meds? I have all that stuff. So do we need to give him anything? We go. And then are they safe to return? So I can't put anyone out there that I don't think is safe. And I've been in some strange situations. I had a guy who was toward the end of the season, contract year, had to, if he played X amount of plays, he was about to get a huge paycheck. Well, he was 3 plays away and he got hurt. So he's in the tent with me with a bad knee injury that, could he have gone out there? And I didn't look, this never even came into my thought process. I was taking him out. He's like, can I go back in? I'm like, no. He's like, Doc, if I play 3 more plays, I'm gonna get paid a ton of money. And I'm like, yeah, but you're also our left guard, our left tackle. And if you go out there and our quarterback, his career is done because you can't block for your 3 plays to make that much money, you screwed our whole team. I wouldn't let him go out there. I was like, I don't care. Like, that doesn't, like, I'm not letting you out there. So I'd hold the guy out. He lost a lot of money, but what else are you supposed to do? He's got 10 other people that are dependent on him. I mean, how selfish is that? So I took him out. Well, you can't go. All right, so let's say they can't go to the tent. Now we got a problem. Now I really need you guys, right? Now we're involved. Now it's like, hey, I'm putting the all call sign. So the all call sign's the X. If you ever see the X on the stadium, that means they're calling everybody. Something really bad happened. Usually you'll just see 2 signs. You'll see cart sign and you'll see the X. If you see the X, we got a problem. And so they'll probably TV will cut away. But if you're ever at a game and you see that, you're like, yep, there something really bad happened. So this is a guy that had a femur fracture, right? You guys may go to a car accident, see a femur. His leg was completely kind of off to the side, didn't look right. He was screaming about his knee. So I'm thinking, okay, does he have a knee dislocation? But the minute I go feel it, you can really feel crepitus. When you start feeling crepitus and grinding, that's a long bone fracture. So then best thing to do is just realign. So, you don't need to do a dramatic reduction or anything, but get them realigned because that helps your neurovascular structures at least realign, and then air cast them. And so that's what we did with him initially on the field. He had a midshaft to distal femur fracture. Actually playing the Broncos. This happened last year when I was with the Saints. And if you remember that play, he was our running back. Well, I guess he's not here anymore. Estime, I think it was Estime, came in, and it was not even that violent. It didn't even look that violent on the sideline, but midshaft femur fracture. So we had to take him. So this is where, again, I'll just use Roger because Roger works with us. So I call Roger. So Roger, Ames is here, and then This is Dr. Mates, who's our foot and ankle doc. He's my partner, myself, Andrew Holland, and Steve Garrity. So these are the medical docs. Roger loves taking pictures. And I don't know if it's just because Roger's like about to retire. So this is like a memory book lane, but Roger just takes pictures all the time. But he also likes making AI photos. So he turned us into Toy Story. So that he took the same picture and he made us into Toy Story. So this is so Roger. So this is so in the 60-minute meeting, this is where then I have Roger talk a little bit about what we do, EMS transport, how's everything going to work? How's the whole team kind of situated? Roger loves doing that. So I just pass the baton to Roger on how that's done once we have to go to transport. So what I did is I changed everything to St. Anthony. So Empower Field with the Broncos used to be 3 different hospitals they would go to, which was ridiculous. And so I'm like, we're not doing that. I'm not going to one hospital for long bone and ortho trauma and one hospital for cardiac and one hospital for C-spine. I'm like, we're going to figure it out right here at this hospital and I'll go get everybody to do this. So we changed everything. So then when we sit in that meeting, I can just say everything goes here. And Scott Phillips helped tremendously because now we can carry meds. So even better for these away teams. So we play the Giants Sunday, right? They're going to fly in. Someone inevitably is going to get hurt at the end of the fourth quarter and they're going to need meds and it's late and they want to get to the plane. Well, now we don't have to worry about an ambulance or a police transport to get to a pharmacy, to get a narcotic late on Sunday evening. Scott, and through the help with St. Anthony's, now we can carry some narcotics in a Pyxis with the ER docs and you guys, so I can dispense 3 doses. Right? They just need a dose post game, a dose probably in the evening and one in the morning, and they'll see their team doctor in New York and we're done. But it's a lot more efficient. It's better for the player. It's, the patient. Think of it as a patient. Yeah, they happen to be a player, but it's better for them. They get taken care of and it's efficient. Team can go back. The Giants are happy. Nobody had to wait the plane. No one's delayed out at DIA. And so everything gets done quickly. So we changed all that. And so now we've set up all the cervical spine. Obviously, the cardiac was always there, and now the trauma stuff. So everything can go there and we can be the facility, Common Spirit in St. Anthony's for anything at Empower Field and whatever our new stadium is going to be. Because 5 years, 6 years from now, when the new stadium's built, we'll have a Super Bowl here probably. So that's in game. All right. So now we've managed in game. So you think it's over. Well, it's not over. You still have coverage. And so, even at halftime, we're doing IVs on guys. So that's where a lot of like Roger and his team will help because you guys are experts at dropping IVs on everybody. You're better than what I would do. And so we have that set up. So we got all that teed up. So that may be during game and maybe post game. We're also setting that up. So then post game, it's still not over. We still got a ways to go with this on all the post-game stuff. So immediately after the game, they're coming in for post-game clinic. Like I'm not getting to leave the stadium like right after the game ends. So now I got to evaluate all the players that got hurt. And if you watch a game, you may not see me go out on the field a couple times, but we may have a ton of guys down. I mean, there may be guys playing with injuries that the season may be over. They made it through the game. They're done though. So it's a ton. I mean, it's a ton of stuff right there and they want information. They want information already preliminarily of like, where are we with this guy? How long is he going to be out? What are we doing tomorrow morning, et cetera, or even treatments. So sometimes I'm injecting guys. If I know it's a grade 2 AC joint, I know it. I already got stadium x-rays. I have my ultrasound I travel with. I already know what's going on. Why delay till the next day? Inject them because you get already ahead on that player and then the availability for them to be playing potentially the next week. So it's immediate care. It just doesn't, you just don't want to wait. You just don't want to delay because every day matters in the NFL. So then imaging. So now I got to set everything up. So I've teed everything up with an MSK radiologist and a partner for an imaging center. So we have it all squared away because imaging is so important in the NFL. If you have bad scans, you get bad information. You got bad information, you're going to look real bad. In fact, I'm probably sitting in this position now because 12 years ago, me and my partners in Dallas, Texas, spent a lot of money to get right diagnostic imaging. And I took care of Sean Payton's kid. And that's kind of how Sean and I first developed a relationship. So, and it was because of poor imaging done at a different facility and what we decided to invest in. And it made all the difference because his son ended up playing his entire senior year, football and basketball. And so you don't get many senior years back. So I think Sean has always been forever thankful for that. So I have to schedule everything. So now I'm sitting there, taking off my orthopedic surgeon hat and putting on my my glorified admin hat, and now I'm scheduling everything on what x-rays, what MRIs, who goes when, who's first, second, third, fourth, fifth in the scanner, who's the reliable guy, he's going first, who's the one that we really have to get, we're making him wake up first, because we start scans at 6:30 in the morning. So they start getting scanned right after Sunday. I'm scanning them. Some games, if it's a really early game, or I would do this in New Orleans, I was scanning them that day. I was sending them straight. Like if they got hurt in the second quarter and I knew you weren't coming back, they went to the scanner. I sent them straight to the MRI, because if I could get the information faster, we could get players in quicker and information to the staff faster. So now you're on the phone first. So now you're getting the best free agent available on the street to fill in for a guy. So now now all the coordination occurs, because I got to make sure everybody knows imaging center, MSK radiologist, and any consulting doc. So I don't do hand surgery. I don't do wrist fracture stuff like that. If I get a guy, I'm already calling the guys I know, giving them the information so we can kind of get going fast. So now Monday rolls around. So now I got to get to clinic. So now I'm seeing every player injury, because they're going to walk in. Guys that didn't show up yesterday are going to show up. Hey, this happened to me. And I got so many videos and pictures of stuff that evolves overnight that is just unbelievable. It was too long to start including in this lecture, but you got to start looking at them. And I saw 22 guys on Monday. So you watch the London game, you're like, oh, look pretty clean. Not a lot of guys got hurt. I saw 22, you know? So a ton of them are injured. They report the next day. Now I got to set up additional imaging. Hey, imaging center. Remember I told you there was 5? There's actually 7. So I'm sending 2 more. So now we got to coordinate that. And now all the procedures get teed up. What do I got to do? Any procedures I have to set up? Do guys have to have surgery? Now I got to deal with, do they want second opinions? Well, it's not do they want, it's almost mandatory in the NFL. Every single NFL player is going to get it, because I do a ton on Monday afternoon. I've operated on a bunch of Chiefs players, Titans players. I've seen Pittsburgh Steelers players. I've seen Jacksonville. You get calls, LA Rams. I'm going to be doing the second opinion for their docs. It's all over, because it's almost mandatory. So every player, 2, 3, 4 opinions they're getting. Now we got to set up the injury report. Who's in, who's out, how long are they out? And we can't miss. So I don't get the benefit of the doubt of being like, oh, you're 95% of the time right.
So you then set those injury report, because there's defined categories, right? That's
So
your goal there,
that gets distilled down with so Vince Garcia, our head athletic trainer, Bo Lowry, director of sports
Yeah.
medicine, that gets distilled down in different terminology. So I got to stick to the medical. They can then decide, the question probable, what the NFL requires on their designations. So I let them kind of distill that down, but we have to come up, with accurate timeframes for NFL players based on as much information we have at that time, and hopefully we get everything. And usually by then, I usually have most of my information, and then you can't miss. You just can't miss. You can't be like, oh, the guy will be out 1 to 2 weeks. That's a 6-week injury. That's a disaster. You can't say it'll be 6 weeks and it lasts 12 weeks. You cannot, you have to be so accurate. And that's it's hard, because nothing in life is black and white, especially in medicine. And all these players are different, and there's other agendas involved that I can never control. Contract year, non-contract year, player, who they are, personality. You have no idea. But so you gotta do your best. So now it's all roster management. Are they in? Are they out? How long? Are we putting them in IR? Are they going short term? Are they going long term? What are we doing? Are we saving a roster spot? That gets crazy, and it gets really complex. Where thank God Bo Lowry and Vince Garcia and our trainers, everyone else that works with us is super helpful. And Matt Key, physical therapist for the Broncos, you have to come up with these game plans. Reason being is we got to figure that out, because now the free agents start rolling in. So every Monday afternoon and Tuesday, I'm going to have free agents coming in. Who's filling the spot? You have so many people in the practice squad. You have so many people on the roster. Who's going to fill in that spot? You got a guy go down, who's coming in. The quicker we give information, the quicker we give accurate information, the quicker our front office, George and everyone else and Rich can figure out, and coach, and like, who we getting? Who's the quickest? Can we get to them first? Who's available before another team gets them, before another team? So we're on there. Now I got to give it a medical grade on every single one of these players. So now they come in, now I got to do a full eval, a full orthopedic and medical, deliver a medical grade on what that player's risk factors are. And so they have that. And then sometimes they get waivers. So you get a guy that comes in, he's got a terrible looking knee or a terrible looking ACL graft or a terrible previous injury that may require a waiver. So that means, hey, look, we'll take you. We're not responsible for that. Or hey, we're gonna take you, but we're not gonna, if something happens or that issue becomes another problem, we're out of it. So that's all important stuff. And you have to be accurate on the imaging and the grade, because you may get a superstar free agent that you want, or not, most of them are not superstars, but you may want the one you want. And the team is going to say, well, you're putting a waiver on them, but that team's not putting a waiver on them. Well, we're not coming here. So you got to be judicious. You got to kind of know, and that becomes all in the negotiation process that, thank God, it's above my pay grade. I don't got to worry about it, but I better deliver good information. So now Wednesday clinic rolls around. So here's like, what did I miss on Monday? Did something evolve? Someone get worse? Someone get better? Where are we? So I got to go touch base with them on Wednesdays to figure everything out from, game coverage. Is the player trending in the right or wrong direction? Where are we going? And then any of my previous ones. So who got hurt 3 weeks ago, 6 weeks ago? Who had surgeries? Who were following up? You got to remember, like, you can't forget about those. They're just all still stacking up. There's a lot of players we've already operated on from some season-ending injuries and other things that you're still following them. You guys still got to take care of them. So then Friday clinic rolls around. And so this has kind of become my, hey, I'm there, but also some pregame injection stuff. So I do a lot of ultrasound stuff, and I think it's way better. I'm not into medications and just doping people up. I can do ultrasound guided blocks, because if I can safely just block pain, something that's stable, they can play with, that's huge. And so I do this on Fridays now because this guy, I love Alvin, but I put Alvin in here because this is kind of a crazy story. Alvin's a great guy. So Alvin had a hand fracture and ribs. So I was injecting his ribs and his hand just so this guy can play. And so Alvin was like, hey, can you just inject me? And I'm like, yeah, I'll just do it pregame. I was like, but Alvin, I'd like to do this Friday, because if you never had an injection in your hand, you're running back, like, you may want to know before the game. He's like, no, doc, I trust you. He's fine. Don't worry about it. We'll just do it. We'll do it pregame. Well, how much do you inject for a metacarpal fracture? What do you do for a hand fracture? What's the dose? 2% lidocaine. You put a little bupivacaine. How much? What's the right amount to block pain but preserve all hand function? So I'm like, Alvin comes in, we do a little hematoma block. I have X-ray. I have ultrasound. We block it. Well, dorsal part of the hand. What's on the other side? Well, your thenar eminence. Well, what's there? There's a recurrent branch to the motor nerve of your median nerve. Well, you got to block the fracture, but can it leak? And what if it leaks? We don't know. So Alvin comes in about 20 minutes after the injection. Doc, I can't tie my belt loop. My thumb doesn't work. We're like 20 minutes pregame. Okay. How are you going to hold a football? Like, this is not going to go well. So I'm like, Alvin, just keep moving your thumb. This thing's going to wake up. It had to have just leaked. So I'm like, Alvin, just carry the ball in your left hand. So the whole game, first half, Alvin's left. He's taking a sweep on the right. What's the number one thing a running back needs to do? Get in the damn right. He can't though, because I know his thumb's not working. But Alvin's so nice. He doesn't make a big deal about it, nothing. And sure enough, by halftime or even the end of the second quarter, it starts wearing, the motor block goes away, but the sensory block is still great. So he's playing. Now, he wouldn't have played if we didn't do this, right? There's no way he's holding a ball with a broken hand. And Alvin's one of the toughest guys I've ever taken care of. And so he's playing, right? People are hitting his hand, but his thumb. So ever since that day, I'm like, that's it. I'm doing a trial block on Fridays. Like, I am not, I love, and if it was anybody else, I probably wouldn't have let Alvin talk me into just doing it on Sunday. But ever since then, I'm like, nah, we're doing trials, because it's like dialing up a cocktail. Like, do I need to give you a little more? Was it too much? I try and tell them, hey, start the clock. How long did this last? Did you get enough pain control? Because we can dial it up. I have every med under the sun. I have every concoction I want to put. How much lidocaine, bupivacaine? Do I want Exparil? Do I want ropivacaine? I can dial up however the hell I want to do it. But sometimes you got to just figure out the cocktail for the injury. It doesn't always, it's not perfect. Like, oh, you just give that much for every person on every injury and that's it. There's a little art and a little science. So thank God Alvin gave me a little grace. And then I'm available just for last minute things, before Sunday, before this whole process starts, all over again. And now you're back to pregame. So that's kind of my, I don't know, my week for coverage. I know it probably didn't go super into everything EMS involves, but at least you can see kind of where your role is. And it is in sports medicine. You're part of the team. You go back to that photo and you can almost just end on this last photo, because that's the main one, right? I mean, at the end of the day, if I can pull up this main photo right here, that's what it's about right here, right? You guys are part of the team. I mean, everyone here has their role. Everyone's got an important job and kind of doing, what they're best at. And that's really what it comes down to. And I'll update this next year and I'll put my Broncos one in there because it's about the same number of people because every NFL the mandates in the NFL it's fairly similar. You can do a little bit of kind of what you want individually per ownership, and thank God in Denver we have look unbelievable owners. I mean, Greg and Kerry are unbelievable. I mean, this city. I mean, we're thankful. I'm thankful having them because they'll really revolutionize not just what the Broncos are doing, but for this city. And they've given us every resource. They've given me every resource possible, and they recruited me to come here to just do the best for these players. And look, if we win, it's great. But my role is not to make sure the Broncos win games or whatever. It's really take care of the patient because they'll be a dad one day. They're someone's son. And so we try and provide the best possible care, but it comes down with putting a team together, and you guys are a part of that. So hopefully that was, I don't, maybe what you guys expected the talk to be, I don't know, but if there's any questions or anything I can answer, let me know. But if not, thank you for having me. Yep.
You went to the final of last week and the week before, and they don't seem to have very good medical protocols. I don't know, one of the players had a concussion in someone's leg and head and neck injury and was laying there for a long time. They finally got her up. She couldn't even stand, was back on the floor, and then they eventually sort of walked her off the floor, but she had one of a concussion, but also potentially a cervical injury. And they're sitting there going, why didn't they do anything? And no, they didn't, put her in a seat collar, they just let her walk off, but she couldn't even stand.
Yeah. So spot on. I mean, so Alave, right? I'll use that. I mean, or a lot of other guys, if they're concussed and out, but we know so the NFL mandates myself, the head athletic trainer, and really our director of sports medicine. So me, Vince, and Bo have to go on the field anytime a player goes down. We have to be the first people there. A lot of times with concussions, you guys have probably managed them. Someone may be concussed and out for 20, 30 seconds or 15 seconds, and then kind of come to and somewhat act normal, right? But if we're out there and they're out, I'm spine boarding them. So if you notice in the NFL, the vast majority that get spine boarded, it's not cervical spine trauma. It's exactly the situation you brought up. But other leagues, they're not adept to this. This is why I really want to present the NFL perspective, because shame on the WNBA, that player should have been, us in the NFL, we would have spine boarded them every day, twice on Sunday. They would have been done, and that would have been quick, and they would have been off. They would have then been evaluated separately out, but take them, right? Because you don't know is it a cervical spine trauma and concussion? Because that can absolutely happen. So, but it's sad you see that, right? Goes back to the first I was saying, it's work comp with 17 million eyes watching. If that WNBA team and physicians look back on that, would they be like, yeah, this was appropriately handled? They're probably like, and then the question is, did they practice? Like the pictures I showed, are they doing this in the WNBA? Right? You don't know who the leader is, right? No,
Wound up in the hospital with rhabdo.
it's embarrassing.
Walk and they went up, instead of putting her on a stretcher or even a wheelchair, they basically dragged her.
It's embarrassing,
I was like,
right?
she went down because she couldn't stand.
So we took care of the Dallas Mavericks when I was there, and we had all that in place. So every league. So now I'm the team doc for the new
I
soccer
was gonna
team we
say,
have.
are you gonna be taking?
So now I'm taking over the NWSL team. So the FC Summit Denver Summit FC. So I'm their team doc. So I'm helping them kind of put their stuff, but we're going to use a lot of the standards. I've read their medical bylaws. So every league has either whether a collective bargaining agreement or a medical bylaws. If you really look at them, because I've read the NBA one, I've seen this now NWSL one. I know what the NFL one is. It's really pushed to the standards, I think, of the NFL. I think the NFL has just about the highest possible standards. And then is it money? Is it why? I mean, why does that WNBA team, why should those female athletes have anything less? So I took over now, incidentally, the Blaze. We have a professional women's football team here. So I'm working to handle and work with them And I've talked to Scott Phillips on how do we get EMS, how do we cover them, as best as we can. Like, look, are we gonna get to the standards of the NFL? No, that's a ton of money, but we still need to provide them good care and do the best possible thing we can with the resources we can. At the WNBA level, that's embarrassing to me. Yeah, that's terrible.
Can you talk a little more about how you guys train and run cardiac arrests in that setting, and then nuances to what interventions you're running on the field versus once you've done?
Yeah, so that's so the biggest thing that we've kind of seen some I don't want to say controversies. Some people want to run codes for 30 minutes on the field without moving. Other people say, look, we'll run the code, but now with what's the device?
Like on a pulse or
No, what's the compression device? The Lucas.
what?
Yeah, if they can get that and all that set up, they don't need to stay there for 30 minutes. They can move them. Now, logistics, okay? Now it comes down common sense. Does every player fit in a Lucas? Some of these guys are 330, right? They got pads on. So we have full protocols on how we do the cardiac arrest stuff. So like in this scenario, I don't even know if I'm standing out here. I can't even tell, but in, these scenarios, let's say someone goes down, right? It's common sense. If someone's walking and they have a Christian Eriksen and they drop, it's cardiac arrest. I'm ripping the shoulder pads off, helmet off. I start CPR until one of you guys taps me, and through our process, I'm moving out. If someone takes a hit, a direct blow and down, look, I won't use names on some of these for HIPAA reasons, but I've gone out there, people have been concussed, down, prone. Man, I've had my thumb or my fingers up checking for carotids. I've been in femoral arteries. Sometimes these guys are taped everywhere. I can't get a radial. So I'll go straight to a carotid because sometimes they're out. And then I've been in a situation where they've been prone and out, and I'm like, is this cardiac arrest? They have a traumatic cervical spine problem. Because at that point, the debate sometimes is, do we care about the cervical spine, or are we flipping them, starting CPR, ripping their helmet and shoulder pads off? Most of the standards now for cervical spine is kind of what you saw with most of these players. Face mask off, helmet and shoulder pads. We travel with an athletic trainer on the ambulance to the hospital where the rest of the equipment goes off. Some teams, and I don't fault them, some teams take everything off on the field. I have no problem with that. You just better practice that. If you can do it quickly and efficiently wherever you are, Georgia football, Ron Corson's really big on that. They do everything. No problem. Just practice it. But it's sometimes easier in that moment, life-saving stuff. I'm not so worried about the equipment per se, especially if it's, hey, they're awake, they're alert, you're concerned of a C-spine injury, just go to the hospital. No one's gonna survive on that field if something goes bad. Just get to the care. So that's what most I think teams do. The cardiac arrest, once I'm there, again, I pass it off. We then have our ERPs, so the red hat guys I'm telling you, and girls, they'll come on and then I transfer them. So Dr. So-and-so, it depends because we have different people that cover. So maybe it's Jason covering or whoever's covering, we'll just use Jason. Hey, Jason, I'm out here. Hey, this was obviously, non-contact fell, atraumatic, not concerned. I'll pass to him. So there's a direct communication. I step away. He's the code leader. He runs it. I'm out. And then Jason runs it with New Orleans or Roger now here or whatever. They are running the code, but that's run with the ERP, and then someone else is kind of managing and watching, kind of overseeing. But then we practice all that. So they'll run it, and then as quickly as they either get the Lucas on, then we're transporting. If they have to stay, they stay. Anything else? Well, thank you for having me. I appreciate it. Hope this was a little behind the scenes look at kind of coverage in the NFL. Hopefully the WNBA and any other league kind of sees this, because I really do think this is about the highest level. Now the NFL's got a lot of the money and a lot of the resources to do this. But I think some of these principles can be taken and applied to other leagues.
This is excellent on team dynamics and how to get
Yeah.
stuff done, so.
Yeah, that's how it is. I mean, we're all part of the same team. I mean, it's really, everyone's got their job to do. No one's better than the next person. And it just has to be just a chain of events of how things occur. And so now it's all coming to common spirit. So, 5 years from now, or even Sunday, at some point the world will be watching us one day, because something will happen. There'll be a DeMar Hamlin event. There'll be something will happen, and they'll be looking here, and they'll want to know that, how'd they do it in Denver? Well, hopefully we've practiced and have done everything, and and everyone does their job and we can be really successful and looked upon. Because now, if I look back, Bill Knight, who was the guy at DeMar Hamlin, he's now like one of the main medical directors for the NFL, who was part of saving DeMar's life, who was with me in London, who's now going over there at all these different places, making sure the ERPs, the emergency response physician, the EAP, emergency action plans, are all teed up at all these venues. Because now the NFL is going to Dubai, we're going to Australia, we're going to Spain. It's like it's now becoming global, but they make sure that the standards that we have are then brought and pushed. Because I think as the NFL standards go up, it raises the bar. Everybody else needs to meet those standards. I mean, that's the gold standard of quote unquote game day coverage. I know it's not possible for every team or sport or high school. I get that, but it doesn't mean you can't aspire to try and get to that level of care. Thank y'all. Appreciate y'all.